Good morning. I'm Pamela Badolato with Mainline Parent, Philadelphia Family, and Bucks County Parent, and we're here this morning with Dr. Salwa Sulieman, an pediatric infectious disease specialist at Nemours Children's Hospital. She's joined us a few times before to have different discussions regarding the pandemic and other topics, and she's joining us again this morning to answer some of the questions that have been submitted by our team and our community. She's been in practice since 2014. And throughout the COVID-19 pandemic, Dr. Sulieman has been a trusted source of information for parents in the Delaware Valley. Her expertise has been regularly sought by media outlets, school districts, and pediatricians across the region. Welcome, and welcome to everybody who's tuning in to watch us here live or catching our recording after the fact. We will be posting this over the next couple of days so that anybody who wasn't able to catch us live can see the recap. So there's been a lot of talk among parents that are just personal thoughts about, what they hear in the news, because everybody gathers just their little tidbits. They read a headline without reading an article, or they say to their friend, "Oh, did you hear?" And they're catching their little tidbits of news. So first and foremost, we were kind of just hoping to get a little update on what's most current in terms of what we're seeing with kids and COVID right now.
Good morning, everyone. Happy to be here again to see you. I know the last time I was here was in September. Things are clearly very different than they were at that time, and today is February 2nd. And so I'm going to give you a little state of the union on COVID as it stands. Certainly things are looking better now than they were even 2 weeks ago. Our case rates globally and nationally, certainly in the US, are going down. We are about 450,000 cases a day in the US. 2 weeks ago, if you can believe it, we were about 800,000 cases a day. So that's very good. In the Northeast, we're even better. In the Northeast, specifically in Pennsylvania, Delaware, New Jersey, all of the numbers are going down. But I don't want that to be lost, unfortunately, in the fact that our numbers today are exactly where we were December 2020 when we had our peak of our cases at that time. So we are exactly where we were in the dreaded December, second week of December 2020 when we had our big increase. So we are absolutely on the way down, which is great, but we are still at really high numbers. But I do anticipate that this was sort of like an ice pick, that Omicron really went up very high and is going to come down really fast. And probably 40–50% of the population has been infected with Omicron. Omicron has been a bear of a variant for sure. But the hope is that that's going to give us some natural immunity to those who became infected, in addition to those who are vaccinated. So the trajectory here is that Omicron is on its way down. I hope it's on its way down for a long period of time. The prediction is that, really by, March, April, we're thinking spring break, those numbers are going to be much, much lower. And as we head into the summer, those numbers are going to be much, much lower. But, with COVID, we never say it's always going to be this way. There could be another variant, but I'm really hopeful that we're going to see declining numbers as we go down. Now, I did want to mention one thing about pediatric cases. Pediatric cases have been the highest they've ever been. We had over 1 million cases in a week 2 weeks ago. That's across the nation. So really, really high numbers. A lot of them are kiddos who have not been vaccinated because our vaccine rates have been very low nationally. And so unfortunately that has happened. About 22% of the cases of COVID and Omicron that we're seeing right now are in pediatrics, which sort of mirrors the population. But we are going to see those numbers go down. And so I think it's an even better reason that we're talking about it. But kids are proportionally being affected, as we would expect, and more proportionally affected than we've seen with previous variants. So I'll stop there. And I'm happy to talk about lots of things, but I'll stop there with that State of the Union.
Excellent. Thanks so much for the update. I like that you call it the State of the Union. It's timely for this time of year. I also thought it was kind of funny this morning that we were having this conversation again on Groundhog Day. So I also wanted to welcome Sarah Bond here. Sarah Bond is the Mainline Parent, Philadelphia Family, Bucks County Parent, founder and creator. She's going to be co-hosting with me this morning to share in some of the Q&A portion as well. Sarah, did you want to go for the next question?
Actually, I have just posted our live and shared it with our 3 community Facebook groups. So I just wanted to say, if you have any questions, please feel free to comment on those threads or send me a direct message. I'm happy to pass along the question here.
Excellent. Okay, so Dr. Sulieman, what kind of questions have been the most popular ones asked of you in the last month or so, since we've been, well, a couple of months now, since we've been dealing with Omicron? I mean, I know we've got a list of questions to ask you, but in your experience, you know, whether it's, you know, parents you see at school pickup or on the weekends, or, you know, in your office as a physician, what are the most common questions you're hearing?
I think certainly by far and away, it's about the vaccine. Is the vaccine safe? Is the vaccine effective for all of those with children younger than 5? When will I ever get the vaccine? And if we get the vaccine, would you give it to your child? I don't know. I have 8 and 10-year-old boys, and then I have a 10-month-old daughter. And so even though it's very important to me as a physician and a pediatric infectious disease physician, it's also, you know, dear to my heart personally. So I would say the vaccine is the biggest thing. And maybe I'll just spend a couple minutes on the vaccine here, because we just, you know, got a lot of new information yesterday that Pfizer is going to submit for emergency use authorization, or EUA, for vaccine for kids under 5. So just a brief info about the vaccine. So Pfizer is the only one that's approved under 18. Pfizer has full approval for 16 and up, actually, but for 12 to 17-year-olds, they have approval for 2 doses with a 3rd booster. For 5 to 11-year-olds, they have approval for 2 doses and then a 3rd booster for those who are immunocompromised or have high-risk medical conditions. Actually, mostly immunocompromised for that one. And then under 5, I shed a tear. I was just sharing with everyone that I shed a tear in December when they reported that their efficacy data for 2 to 4-year-olds essentially wasn't good enough for 2-dose series. And so what has come out of the information yesterday, and you have to read between the lines a little bit here, is that Pfizer is going to submit for emergency use authorization for less than 5-year-olds. And it's not because they have new data. I think it is purely because Omicron has had such a significant impact on kids under 5 that they are feeling the pressure to get them vaccinated. The safety data has always been good. Let me make that clear. The safety data for 6 months to 5-year-olds, which is under 5-year-olds, is what they've been studying. That's always been good. It's the efficacy, meaning does it work with the dose they gave them? And so it actually worked very well in 6 months to 2-year-olds, just not 2 to 5-year-olds. So they submitted, they're going to submit information to the FDA to start the 2-dose series with a planned 3rd dose with the same dose amount 2 months after. So you get it at day 0, you get it at day 21, and then 2 months after that, you would get a 3rd dose. And so the EUA would be to start that series, hoping that in a month or so, when we have that data for the 3rd dose, that it's going to work. And so it's not that we have new data, which is very tricky. I wish we did, but they're presuming that the data is going to be good. And so what that means for us and what that means as parents is that probably they'll submit that data, you know, I would say sometime this week based on what they're sharing, and then 4 to 6 weeks of review by the FDA, and then the FDA will vote. And then there could be other multiple groups that will vote. They could call in the VRB PAC, they may do that. There's another committee that they'll call in, the CDC will vote. So best case scenario would probably be end of March, maybe early April. We're really going to have to see the data. None of us have seen it. It's all, you know, really just been submitted to the FDA. So stay tuned, but there is a possibility end of March, April, potentially under 5-year-olds could be getting the vaccine with the hope that it's a 3-dose series.
That's good information. And it's always so much better to hear it from someone who can explain it rather than just reading the black and white words in the newspaper article or on the internet, where, you know, we're unsure what's new that we're reading today compared to what we've read a couple of months ago. So it's really helpful. Someone submitted a question saying that this Omicron variant has been mostly mild cases in those who have caught it, likening it to hardly being anything compared to other colds and viruses they have had. In terms of viruses and mutations, is this a good thing? You know, as we see new strains come out, will we see, less illness from future strains, or is the risk still there that a more more virulent strains could come out from this? Is the trend for weaker strains to emerge, and does that mean we have won if the strain keeps getting weaker and weaker?
Yeah, so that's a really good question. It's a little bit of a dual-edged sword, right? Because we're happy that it's not Omicron has not been a more doesn't cause more severe disease. Now, part of that is because we have a lot of vaccinated adults and some vaccinated kids. Part of that is the intrinsic portion of the virus itself, but it is intrinsically not causing severe disease. I mean, and the people that do get hospitalized have really been people that are unvaccinated for the most part. Now, it doesn't mean there definitely are people who have been vaccinated and boosted, even healthcare workers that have gotten Omicron and had very mild symptoms, but have still gotten disease for sure. So is it a good thing? It's a good thing in that a lot of people got Omicron and a lot of people have natural immunity to Omicron, vaccinated or unvaccinated. The question becomes, does that natural immunity from Omicron, how long does it protect us? Does it protect us for 3 months or 6 months or longer? And because it was not as severe, are you going to lose your memory essentially to Omicron and your memory that sort of would give you some cross memory with other variants that may come up? We don't know that. I think we can presume from other variants that if you get COVID today, you're going to have good memory for about 3 months, and you may have it a bit longer. But with Omicron, we just don't know. We'll have to sort of see what the data looks like. But that is good. It's hard to say that anything is good, but it is good because a lot of the population has some natural immunity. So you can say, in theory, maybe over the next 3 months, we're going to have a bigger chunk of the population that has natural immunity to COVID and some memory to COVID to prevent them from getting severe disease and maybe even getting infected again. So that part is good. The part that's not good is that the more people get, the more if it's some people feel like, oh, if it's not that bad, then I don't need to get vaccinated and I don't need to use all these mitigation strategies like wearing masks and social distancing, et cetera, because we're all tired of it. I feel you. I am there with you. It's real. But I don't think we're at that point where we can do that yet, because the more the virus circulates, the more it mutates. It mutates every 2 weeks, and it is a matter of time before it does it again. So, we don't want a big surge like Delta. I mean, Delta was the worst because it went from being, it was like 500% more transmissible. I mean, Delta, it was just not good for very many reasons. And we just don't know if we're going to have a more transmissible and a more severe variant at the same time. We certainly don't want that to happen. And so it's good and bad. I would say that I'm hopeful that as we head into the summer, like we got over our winter surge, we had something where a lot of people got infected. We have a lot of natural immunity. We head into the summer where naturally numbers are a bit low and things will really be good for us. And hopefully we'll have more vaccinated people, vaccinated in all age groups. And like that all together is good. I'm going to try to stay positive here.
On that note, Dr. Sulieman, somebody asked, and I'm so glad that you told us about this, how it mutates every 2 weeks and new variants emerging all the time. It's important to keep in mind. One of our community group members asked, though, about the mask requirements in their school, because obviously everyone's eager to get past that. And with the Omicron variant being mild and without a lot of symptoms and most school staff being vaccinated, they're wondering what you think about school masking. And when, or could it end?
Yeah, it will end. This will end at some point in time. It will end, meaning it may just become endemic and something we live with. Now, I think masking will become optional. I use the word optional because I think there are definitely some families like mine that may mask for a very long time. I mean, I am, as you can imagine, I'm just very conservative when it comes to some of these things with my kiddos. But I also I think that it is also dependent upon the family, and are there immune compromised patients in the household? Are there elderly, family members in the household? And it's each family's decision, really. So, but I do think it will get better. So I base masking recommendations or mitigation strategy recommendations, I would say, based on really what the numbers are doing. So right now our numbers are really high. I mean, higher, they were really, really high, maybe 2-3 weeks ago. But as the community numbers go down, that's what you really need to look at, as those community numbers. As they go down, I think we're really going to see that we can let up on some of those mitigation strategies. Schools have been really good. I mean, obviously, I don't know every school district, but a lot of school districts have had to do HEPA filtration and really have better ventilation and hand washing and masking. Masking is arguably one of the easier things to do because you just put a mask on, but it's also one of the hardest things to do because people get tired of wearing a mask, and it is very challenging to ask any child to do that for a period of time. But we have to, I would say, as we think about the numbers, so I tend to think about incidents per 100,000. You can find these numbers on the Pennsylvania Department of Health website. When you think about incidents per 100,000, we're like in the 300 and 400 per 100,000. When you get to probably below 50 per 100,000, you can start thinking about reduction in masking or optional masking. If a child wants to wear a mask, or the parents decide they want them to wear a mask, that's totally fine. I think ideally, anytime you get to certainly 10 per 100,000 is like no COVID. And then PCR positivity rates, which is really testing positivity. Numbers below 5% are good and something to start thinking about. And I think a lot of school districts are going to start to sort of let that be. But I think as a parent, if your school district is already optional and you start thinking, what are we going to do that? Think about, who's in your household, if anyone's high risk, and then start looking at those numbers. You probably get notified of COVID cases in your school district. I mean, I've seen dramatic decreases in my children's school district. We're going to start to see those numbers go down, go down, go down. I would say probably the whole month of February, I would think most people are going to still be masking significantly. I think as we hit March and April, it's going to become an optional thing because, like I said, those case numbers are up and then they're going to be precipitously down. But I would be remiss to say we should stop masking because I'm like always masking because you just never know. It's just the best mitigation strategy you have. It protects your nose and your mouth from others, and it protects others from you. So I think it's hard to say don't mask, but I think as a parent, I think you can be realistic in thinking that by spring, I think it's going to be possible.
Thank you. I know it's always, kind of one of those controversial topics to talk about. A lot of people have very extreme feelings one way or another. So it's hard to even have that conversation, whether it's amongst colleagues or amongst friends or just, people at a soccer game or, at a birthday party. But let's talk about the little ones and their masks. My kids are all older, so I don't have to worry about this. Where they go, they're supposed to wear a mask, they wear one. But there's an age discrepancy for the little ones. Some places you go, they say kids 2 and over. Other places it's 3 and over. If you're on an airplane, it's one age. If you're at, a mask, it's a different age. What's the deal there? Like with being 2 years old or 3 years old and like the in between for requiring the mask in different public places?
Sure. Yeah, I think I have definitely seen that discrepancy. So the CDC says if you are younger than 2, so essentially up to 24 months, you should not wear a mask. And a lot of that is basically because, you can think about, my 10-month-old. First of all, she's not going to keep it on, but also, she's not going to be able to like coordinate her hands to get the mask off if like she falls flat on her face and then she can't breathe. And so a lot of that is based on safety, really. But the CDC's recommendation is really below 2. And so daycares, airlines, really it should be 2 and above. Now, I think the caveat to this is that, there's a lot of 2-year-olds that may not be able to coordinate getting their hands and getting the mask off if they fall, but they could at least have more coordination to roll over. It's hard for them to breathe. And so I always stick with below 2 should not be wearing it, and then 2 and above should be wearing it. if they can keep it on. It's really hard, and the 2-year-olds, I get it. It's like something they say, but here we are, and what's realistic as a parent. I think just learning, having them constantly try to put it back on. But I know at our daycare where my daughter goes, they try to get the 2-year-olds to wear masks as much as possible. But it has nothing to do with really transmissibility, that, you know, an 18-month-old wouldn't transmit it as much as a 2 and 3-year-old. That it has nothing to do with that. It's purely a safety decision.
That's good to know. And I imagine for those with kids in that 2 to 3 age range, you know, when you're 2.5 and you're not required to wear it here, but then when you go to this museum, you are required to wear it. The inconsistency, I think, becomes really hard. You know, I remember it being hard to even get a kid to wear a winter hat consistently, and they could feel the effect of that right away. You know, your hands were cold if you didn't wear your mittens. Getting them to put a mask on the chance of getting sick when they're not old enough to make that connection. You know, that, you know, in a week when they're sick, it's because they didn't wear their mask when they went to, you know, such and such museum. They just don't have that ability. So that's always interesting.
Yeah, no, it is. I can see the challenge. I think I have some friends who have kids in that age group, and I'm like, we're constantly trying, and they're just trying to, you know, always try to put it back on them. But I mean, there's just always the inherent risk that they're just going to have a moment, not keep it on, and you just have to let it be.
Exactly.
Deal with it.
What are you going to do?
Yeah, like so many other parenting related things. Just gotta let it go.
Do the best you can. Yep.
Yes,
Yep.
Exactly.
Okay, the next question. How can we best support our children through the ups and downs and managing their expectations as they change day to day?
So this is hard, I think, because I mean, almost 3 years ago, 3 years, we thought, oh, it's going to be 6 months, not even 6 months. I mean, it's been a challenge. And so I think, I mean, what I have done with my kids has been to really talk. I mean, obviously this is in kids that, you know, this is not in 2 and 3-year-olds that can really understand what the virus is and does. But I think it's just like validating their feelings that they're frustrated and this is hard. And we're all doing it. And then being a good model as a parent, like, okay, well, if we are in Target, then we need to wear a mask. Like, this is what we do at this current time. If we have decided as a family, that's what we need to do. Because I think that's the biggest risk right now is really indoors, or if it's required to go on an airplane, et cetera. But I think, you know, letting kids know that it will not always be this way. It will not always be this way. I think the summer is really going to be better. I can't tell you that we are never going to be putting masks on again, like that. Those days might be over. I mean, I think we probably will have to do that again with some type of fall surge, but the virus will either fade away, which I don't honestly get that vibe. It will become endemic, meaning we just deal with it and it's like the seasonal flu, or we will have some level, some higher level. I mean, that's essentially what's going to happen. It's either going to completely go away, which I don't think will happen. It will probably become more endemic, meaning we're just going to live with it, but we can live with it. We have a vaccine. We know what we need to do to protect us, and the levels will be at a steady state. It won't be that the levels are going to be these high peaks. I think we're going to have high peaks for a little bit of time. That remains to be seen, but I think just letting the kids know it's not always going to be this way. What you're doing is protecting your community, yourself, your family. I mean, we have to, when our boys get tired, we say, this is how we can go see grandma and grandpa. Like, this is how we can go visit with them. This is how we can go to their house. And then they're very driven by that because that's something that they really like to do. Or if it's a child that wants to be able to play sports, especially indoor sports, you know, this is how we can get back to normal life. And that seems to have worked with my kids. And I think a lot of psychologists, you know, there's a lot of mental health needs in the community right now, more so than ever, especially in children. And a lot of psychologists have really tried to just validate feelings and, you know, say this will not always be this way. So fingers crossed.
Definitely fingers crossed. So, you know, going back to the vaccine a little bit, do we think that, you know, there's going to be a mandatory vaccination against COVID-19 added to the list of other, you know, mandatory vaccines that our kids must have in order to attend school or anywhere else where we have to submit their their health records?
Mm-hmm. So this is a good question, and a question that a topic that we discuss frequently in the healthcare system as healthcare workers, and what should be a mandate. I mean, a mandate certainly comes with a lot of controversy, as you can tell, but it's really a public health issue, right? So it's really like, how do we protect our community, and how do we protect our schools and our school staff and our healthcare staff? I think that there will be no mandate until there's full approval for all age groups, which will take some time, meaning there's not emergency use authorization, there's full approval. Do I think a year from now or 2 years from now that this could be something that we are required to get to go to school? I think it's possible. Because it's sort of like influenza. I mean, it may do this thing that influenza does, and we have to get a yearly vaccine, or it may not, and it may be something that we get a vaccine for a couple times in our life. That sort of remains to be seen. But I do think that if it continues to cause the amount of hospitalization and severe disease in any age group, I think that is a possibility. But it's not going to happen anytime soon by any means, because it has to have, there's no way anyone's going to mandate it in a school setting. And well, I should say this, in an high school and high school, elementary, middle school type setting. Colleges are separate from that, but they're not going to do that until they have, I would bet, FDA approval.
And building on that, there's another question about expecting, should we expect annual boosters? Do you think like that we're going to continue to see additional boosters be rolled out?
Yeah, I do think that's going to happen. I don't know if it's going to be annual or become annual, or if it's going to be, as we watch the Omicron immunity wane, as we watch that memory sort of go away, are we going to say, okay, now it's time to get another booster? So for example, me as a healthcare worker, I had my third vaccine, I want to say in September, I think. And are they going to say, okay, Omicron, your immunity to that third booster is waning at 6 months. We're going to get it to you at 6 months because you're a healthcare worker. Or is it going to be that in the general population, it becomes a year? I do think there will need to be boosters. I know that both Moderna and Pfizer are actively working on Omicron specific boosters. Even though there is definitely cross immunity with Omicron in those vaccines. So it's not that those vaccines don't work for Omicron. It's just that they're trying to be more specific and targeted towards Omicron. And so they are working on that. But I think in general, as we think about the virus itself, the hope is that we always have a strain that has some cross reactivity and cross immunity essentially with what's in the vaccine. And so that's what they're monitoring, is to make sure that that happens, because the more the virus mutates, the best thing we can do is have as little virus circulating as possible, because the smaller amount of virus we have, the less ability it has to mutate and then cause something like Omicron, cause something like Delta. But I think we are looking at boosters, and I think up to date on vaccines is going to change, right? Is up to date going to be 2 vaccines for a certain age group or 3 vaccines for a certain age group? And so I think that will change. I think there will be booster recommendations and probably eventually booster requirements.
That's what I was just, my thoughts were leading to next about the requirements of what it means to be fully vaccinated anymore, with the requirements in the city to show a vaccine card in order to enter any place where they're serving food. Are we looking for 2 stickers, 3 stickers in 6 months from now? If I only have 2 stickers, but I've had COVID and I'm banking on some natural immunity, there's no way to prove on my vaccine card that there might be some natural immunity fighting things in my body. Like, I know a lot of people are hesitant to get the booster if they've recently had COVID because they figure they have some immunity, but will they then start to see some repercussions for not having that 3rd sticker, but they have immunity?
Yeah, this is the hard part, because every state's different, right? Even Philadelphia is different compared to Pennsylvania. But every state's different, and there's not like a national vaccine card, for lack of a better term. I do think though that there will be, I don't think it's going to happen soon, but I think eventually the metric of what's up to date and fully vaccinated will likely change. I would bet there's going to be a 3rd dose that's recommended for just adults greater than 18 years of age that are otherwise healthy. So it may I have a third dose because I'm a healthcare worker, but I think it's going to move in that direction, because we are going to see, I think, natural immunity wane. And remember that very unique to SARS-CoV-2 or COVID-19, the immunity from the virus itself is not as good as immunity from the vaccine. It is not that way with all vaccines. A lot of vaccine immunity is not as good as natural disease. Chickenpox, for example. Like, I had chickenpox when I was in first grade, and I have robust immunity to this day, and I'm 42 years old. But that is not the case with SARS-CoV-2. So you get a very dysregulated immune response with natural disease, but the vaccine immunity is quite good. So that's another reason to get the vaccine. Obviously I'm very pro-vaccine, but the vaccine immunity we see lasts a bit longer than natural disease. And so that's why I think, and it's hard to know, like, who knows if you had natural disease and you want to, that, but like the staff in the restaurant don't know that, or, it's just
Right.
very hard to track it too. So that's the only thing that may work in favor of it not being required until we have some national system with which we can always check that, which doesn't appear to be on the priority list. And maybe it shouldn't be, but.
Right, it's not something I've ever heard of, there being some kind of national kind of recommendation. Everybody seems to be doing their own thing, by city, by county, by state. So I was just curious if that was something, that's talked about amongst your circles, which are clearly much more educated in the medical field than my own.
Yeah, it's definitely talked about, but it's not, I think, I truly believe that the communication from the CDC and the government could be a bit better on some of these things, especially recently. And so I'm hopeful that that's going to improve over time. I'm just not sure how long it's going to take. But this is such a big public health really concern that maybe something will be created to that effect. I'm just not sure it's going to be in the near future. But I do think the recommendations are going to change for just healthy adults.
Sarah, did you want to take that last one?
Yeah, Pamela, I just want to say thanks for asking that question. That was a really good one. So our last question that we have here is about how can we help to reduce the stigma of COVID-19? I feel like I'm getting text messages and hearing from so many more friends that they're dealing with COVID, right now. So, but there's still obviously a really negative stigma about it. People don't want to share and are shy about being judged for having it. Do you have any thoughts on that?
Yeah, I mean, I even joked with my colleagues over sort of the winter surge when we were having it. I was like, I mean, I can't be the one to go down with COVID. Like, I'm an infectious disease doctor, like my family. And so I get that. And as a parent, you're thinking like, oh my gosh, is my kid going to be the one that like goes to school and has COVID, and then like, or my daughter gets COVID and then the whole infant room is out of daycare. And so I get that. But I think the reality is with Omicron did not care who it was infecting, right? So it didn't. It was everywhere. Vaccinated, mostly unvaccinated, but a lot of vaccinated people had breakthrough disease. And so the thing about COVID is that it is everywhere, and it's going to become on this endemic thing that we all get. A lot of people that do all the right things still get COVID. So and it's just, that has absolutely been the case with Omicron. So I totally understand that. And I know as a parent, like you're like, I don't want to have to be the one to tell so-and-so that like, oh, now my son has COVID and oh, now everyone needs to be careful. But I don't know the best way to get around it, but to just be, to be truthful and to say that like, this is not a scarlet letter on anyone. It happens. It's no one's fault. But if you know that you're doing all the right things for your family, you're wearing your mask when you need to, you're trying to get your kids to wash their hands, even though they never want to wash their hands. You're trying to be socially responsible. I think that's good. It's tough. It's really, really tough.
Well, is there anything else that you would like to just share with our community that we might have missed talking about before we end? I think we've gotten a lot of great information. I'm so grateful for you taking the time to share with us today.
Sure. I think, I would say hang on a little bit longer. because Omicron is on its way down. We're still at really high numbers. Like, don't lose sight of that. And it's, February, and it's cold and it's snowy and it's a bit gray, particularly today. I really think by March, everyone, as spring is coming, the Omicron numbers are going to be better and it's going to be easier to get outside. I think the biggest risk for you getting COVID is indoors, not socially distanced without a mask. I'm not telling people to not go indoors. I think it's acceptable. I think please wear a mask if you're going to go indoors, because that's where most people are getting COVID is indoors without masking, particularly, eating, going to someone's house and visiting. Just hang on a little bit longer. In 4 weeks, these numbers are going to be dramatically different. I can guarantee it. I mean, I probably shouldn't say I can guarantee anything with COVID, but it's the trajectory is that things will be better. I think if you're thinking to yourself, when can we start having play dates again? Like, when can we start going to other people's houses, and when can we start, or can we go back and do indoor dining, et cetera? I mean, I think it's going to happen, and it's going to happen very soon. And just looking at the numbers in your community, but I would highly advise wearing a mask if you can. And then I would highly advise thinking about the vaccine for your kids if you haven't gotten them vaccinated. If you just want more information, I mean, I am happy to talk about vaccines all day long. I vaccinated, my boys are vaccinated, my daughter will get vaccinated the moment that I can give it to her. But I understand the hesitation because there is a lot of stuff in the media, and it's real. So I feel for you. Ask your doctor, talk to your pediatrician. I'm happy to answer questions, but I think it's something really everyone should consider as a parent. I think it will help get us out of this and out of this time where we have to just have horrible numbers. And we don't have to have this happen again. I hope not. So hang in there.
Thank you so much. And thank you to Nemours for being a part of this community conversation that we're able to share with all three of our community groups today, and to Dr. Sulieman for giving us her time again. And I hope next time in a few months when we can sit down and have another chat, we can pick another topic. But as always, we're happy to have the same topic. We want to make sure our community members feel like they're always getting the most accurate and up-to-date information so that they can make the best decisions for their children and their family. So thank you so much for being with us here today. And thank you to everybody who was able to tune in or is catching this on the recap.